Welcome to Health Professional Radio. I'm your host, Neil Howard. I'm going to have a conversation with Mr. Paul Johnson this evening, CEO and co-founder of Lemonaid Health. Lemonaid Health is a direct-to-consumer telehealth company. He's joining us to talk about the critical role that telehealth is playing, of course, during this COVID-19 pandemic and probably for a long time to come, this sudden surge in remote appointments and some of the challenges that have been presented. Welcome to Health Professional Radio, Mr. Paul Johnson.
Thank you for having me on there.
A bit about yourself, if you would, and then talk about your role as CEO and co-founder of Lemonaid Health.
Absolutely. So my name is Paul Johnson. I'm from the UK originally. I moved to San Francisco, California 6 years ago to set up Lemonaid Health, and that's what I've been doing since. At Lemonaid Health, as you said already, we're a direct-to-consumer online healthcare company seeking to increase access to affordable, convenient healthcare to Americans all around the U.S.
Now, is this something that is done through an insurance company or through a person's insurance? How's that done, direct to consumer?
At Lemonaid Health, the way that we have built the business thus far is an entirely cash pay model. So patients are cash paying to use Lemonaid Health out of pocket. The good news is typically our cash pay prices are about in line with or sometimes lower than the average copay because of the way that we use technology that makes our medical team very efficient in the way that they're able to provide care, as well as being able to provide better quality care at scale. We're able to provide care at a low cost point. So some of our services, patients are able to get treated for as little as $15, which is below the average copay for a primary care physician visit.
Absolutely. Now, we've seen this huge surge in telehealth. How are you navigating this huge surge, especially an online platform, cash paying? It must be a daunting task.
Yes. So we feel like one of the positive things to come out of the pandemic is the increased awareness of online healthcare solutions like Lemonaid Health and others. I think one of the challenges previously that has driven the relatively low adoption of telehealth in the US has simply been awareness. We've helped many patients during the course of the pandemic who are using not only Lemonaid Health, but online healthcare or telemedicine for the first time and are sharing with us that they've had a great experience and would love to continue to use online healthcare where they can going forward. Certainly at Lemonaid, we know that we can't treat everything online, but we can probably treat 50 to 60% of the reasons why a patient would see a primary care physician in person, and we can handle that online. And as more and more patients are trying online healthcare for the first time and having a good experience, we believe this will continue to drive increased adoption over the years to come.
What would you say would be a not so good experience? We're talking about telehealth. With this surge, are people waiting online? Are we going to see backups as we did without telehealth in waiting rooms across the world? Virtual waiting rooms.
Yes, exactly, Neil. I think one of the experiences that can be disappointing is if a patient has to wait a long time, or if they are not able to book quick appointment times. So one of the things that we always try to provide our patients with at Lemonaid is same-day appointments. So if patients want to have an interaction with one of our doctors or nurse practitioners, they can always make an appointment for that same day. And for many of our services, we provide immediate video consultations with someone in our medical team, and the wait time for those consultations is typically about 5 minutes. So I think having a quick experience so that it's convenient is important. I think the other reason why patients sometimes leave disappointed is if the medical provider is not able to help the patient online, and that may be for absolutely in the best interest of the patient, but I think that still can be disappointing in the eyes of the patient, the perception of the patient, where they're looking to seek out healthcare online, but actually the best solution is to go and seek out healthcare in person. I think sometimes patients can go away thinking that the online healthcare component was a waste of time because they had to go and seek out healthcare in person anyway.
Does the platform lend itself as easily to mental health issues as it does to physical issues, physical consultations, virtual meetings of a mental health nature?
It does, and actually our mental health treatment services are the services that I know many of the team at Lemonaid are most passionate about. And actually it's the depression and anxiety treatment services are the services where we've seen the biggest increase in volume since the start of the pandemic. So since March 2020, we've seen an 85% increase in the number of patients we're helping for depression and anxiety using our platform, which is the largest increase by clinical service category. And it's one of the areas that we're most proud of our ability to provide great quality outcomes to our patients as well. So 80% of our patients who previously hadn't taken medicine for depression or anxiety have seen a 50% improvement in their PHQ-9 or GAD-7, the scores we use to measure depression or anxiety, within 8 to 12 weeks. And that outcome data is better than a lot of in-person outcome data where outcome data is tracked in person. So certainly the platform works very well for mental health, not just because of our ability to interact more frequently with patients, but also because, unfortunately, mental health treatment still sometimes comes with some stigma, and the online model that we provide can remove some of that stigma for patients, I think.
Paul, where do you see telehealth going forward after this pandemic into the future? Do you see telehealth as being something that's here to stay?
I absolutely believe it is, Neil. And I think when I reflect on the last 10 years of telehealth adoption in the US, telehealth adoption has been extremely slow. Before the pandemic, somewhere around 0.5% of all primary care visits were handled virtually, 0.5. And there's no clinical reason why 50 to 60% of those could not be handled virtually. So we've seen a number of very successful telehealth companies over the last 10 years and slightly further back, but still all of those combined only generated 0.5% of primary care visits virtually. The opportunity is much, much greater than that. And think of the healthcare system of the future, where the default entry into the healthcare system is a virtual interaction. And then, sure, there's in-person interactions where required, but the default go-to is a virtual interaction. I think if that's the case, we can make a better healthcare system for patients, we can make a better healthcare system for providers, and we can be more efficient and help a lot more patients. So I absolutely believe the use of online healthcare is here to stay. I think the question mark is around how and what modalities will work best for patients and providers. But I think one positive coming out of the pandemic is increased awareness of online healthcare. And I think we've all had to learn very quickly how to use online healthcare, both as a patient and a provider.
Where can we go, Paul, online and get some more information about Lemonaid Health?
Lemonaid Health, we have a website and a mobile app on the Apple App Store and Google Play Store. Our website is lemonaidhealth.com.
Great. Paul, thank you so much for joining us here on the program this evening.
Neil, thank you so much for having me on.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.